Okay, so the topic for today is about respiratory drugs. And when we discuss about respiratory drugs, we basically divide the respiratory system into two, which is the upper respiratory tract agents and the lower respiratory tract agents. Of course, yung respiratory system natin is a tract which begins from the nose or mouth down to the pharynx, larynx, and trachea. And then sa lower respiratory tract, meron naman tayong main bronchi, the bronchioles, and the alveoli, which is actually the part ng ating lungs. So, most of the common respiratory disorders sa upper respiratory tract is common cold, which is also acute nasopharyngitis. We have rhinitis, runny nose, sinusitis, inflammation and infection of the sinuses, pharyngitis, kung saan merong sore throat. Sometimes, meron ding nagkakaroon ng infection sa larynx or laryngitis. Ito naman yung wala ng boses, no? There is already loss of normal voice tone because the larynx is the voice box. Ngayon, ang mga upper respiratory disorders are usually caused by bacteria and viruses. And of course, we have mentioned previously sa anti-infective drugs, yung mga gamot na yon, yung magmamanage ng mga sakit, depending if it is caused by a virus or a bacteria. But there are some drugs of the respiratory tract or some drugs which manages the symptoms associated kapag merong mga respiratory infections or inflammation. Usually, itong mga gamot na to, it manages the symptoms such as sore throat, nasal congestion, runny nose, even headache. Okay, what are these? Antihistamines, decongestants, glucocorticoids, antitussives, and expectorants. So, ang antihistamines, it's a histamine blocker which competes with histamine for the receptor sites. Thus, it prevents histamine response. Ang mga H1 are found in the extravascular smooth muscles of the nasal cavity. So very specific ito sa mga respiratory ailments, while the H2 increases gastric secretions. So we will be dealing with some of the H2 antihistamines dun sa ating drugs affecting the digestive system. Ang mga antihistamines ay rapidly absorbed in 15 minutes, but it is not potent enough to combat anaphylaxis or anaphylaxis. Effective siya only for mild allergy. Now, there are two generations of antihistamines. The first generation antihistamines causes drowsiness, dry mouth, and other anticholinergic symptoms. Mabibili ito over the counter, which is totally the opposite of second generation antihistamines dahil non-sedating antihistamines siya. It also causes fewer anticholinergic symptoms and most of it have long half-lives, which is between 7 to 22 hours. Yung mga first gen, they are very useful in treating rhinitis or runny nose, usually caused by common cold, and binabawasan din ito yung nasal itching and twitching, kaya tayo nagsisneeze or humahatching. And these are also some of the symptoms of mild allergy. Brompheniramine maleate or Dimetapp and also diphenhydramine or Benadryl are common first-gen antihistamines. Sa mga second-gen naman, a moderate amount of alcohol and other CNS depressants may be used. And these are cetirizine, loratadine, and azelastine. Now, decongestants are for nasal congestion. Kapag merong nasal congestion, the nasal blood vessels are dilated. The usual cause is infection, inflammation, or allergy. Ngayon, itong dilation na ito nagkukos ng transudation ng fluid into tissue spaces kaya nagsiswell yung nasal cavity. In short, barado yung ilong. Now, decongestants stimulate alpha adrenergic receptors. What does it do to the nasal congestion? Nire-relieve niya yung congestion kasi nagpo-produce siya ng vascular constriction ng capillaries which occurs in the nasal mucosa. So kapag constricted yung nasal capillaries, mawawala yung pamamaga o yung pagkabara ng ilong kaya marirelease mo yung secretions mo. It shrinks the nasal mucous membranes and it reduces fluid secretion or runny nose. It can be administered through nasal spray, nasal drop, tablet, capsule, or in liquid form. Now, when you take decongestants, it's important not to use it more than 5 days because rebound congestion may occur. Ang mga systemic decongestants, ephedrine, phenylephrine, and pseudoephedrine also relieves nasal congestion, but it's for a longer period of time than the nasal decongestants. Although si nasal decongestant na local may act promptly and may cause fewer side effects. And because systemic tong decongestant na ito, it can cause jittery, nervousness, and restlessness, which are systemic symptoms. The next are glucocorticoids. Intranasal glucocorticoids are effective for allergic rhinitis. It has anti-inflammatory action and also decreases the symptoms of upper respiratory tract infections such as rhinorrhea, sneezing, even nasal congestion again. Maaari siyang gamitin alone or in combination with H1 antihistamines for better results. Although rare for systemic effects to occur, but with continuous use, pwedeng magkaroon ng dryness of nasal mucosa. What are these intranasal glucocorticoids? Beclomethasone, although ang beclomethasone can cause oral fungal infection as an adverse effect. Budesonide, dexamethasone, flunisolide, fluticasone, and triamcinolone. Ang mga gamot na ito ay pwedeng ibigay as spray or pwede rin naman via nebulization or nebulizers. Next are antitussives. Antitussives acts on cough control center in medulla to suppress cough reflex. Now, when you take antitussives, it suppresses cough reflex, but remember that the cough is an important reflex para ma-eliminate or ma-secrete ang mucus secretions. Because whenever the airway is infected, yung normal mucus doon changes in consistency. Dumadami at lumalapot yung consistency. Kaya nagiging malapot o dumadami yung ating secretions. Now, importanteng umuubo para mailabas yung secretion. So, never take antitussives if the cough is productive. Antitussives are only recommended for dry cough or non-productive cough. Kaya contraindicated ito dun sa mga lung disorder na importante ang cough reflex. Codeine is an example of an antitussive. Codeine in high doses can cause respiratory depression. So important to always check RR. Guaifenesin, on the other hand, is an antitussive, but at the same time, it can also hydrate lung secretions. Therefore, will allow easy removal of secretion. Hydrocodone bitartrate is also an antitussive. Benzonatate is also an antitussive. But si benzonatate, it's a chewable. No? May mga chewable na forms niyan. Remember not to take it, no? Kasi maaaring may anesthetic effects siya, no? Benzonatate can cause anesthetic effects lalo na pag chino mo siya. So chewing should be avoided if the drug is non-chewable. Dextromethorphan hydrobromide is another antitussive. Expectorants. Expectorants loosen bronchial secretions so they can be eliminated with coughing. But remember that hydration is still the best natural expectorant. And guaifenesin is an example of that. For lower respiratory tract agents, there are also many disorders. We have bronchitis, we have asthma, and we have cystic fibrosis. To briefly explain these disorders, ang bronchitis at ang asthma, merong nangyayaring tatlong immune responses doon sa lower airway ng patient. Una, nagkakaroon ng pagsikip ng airway as shown in the picture. Sumisikip yung bronchioles or bronchi. Pangalawa, nagkakaroon ng inflamed airway, namamaga. And pangatlo, dumadami yung tenacious secretions. Both are occurring in bronchitis and asthma. But what's the difference? Sa bronchitis, it's usually caused by a pathogen, no? Virus or bacteria. Pero kapag asthma, it's caused by an allergen. The allergen could be changes in the season or yung mga nakakalanghap ng mga allergens na na-stimulate o na-stimulate yung immune system ng patient para magkaroon ng ganitong reaction yung kanyang lower airway. Okay, the third is cystic fibrosis. Yung cystic fibrosis, it's an anomaly found among younger children kung saan maraming secretions sa katawan niya yung either absent or thick, and one of which are very thick tenacious secretions found in the airway. In fact, cystic fibrosis children, may poor prognosis sila kasi paulit-ulit yung kanilang pneumonia or yung infection ng alveoli dahil sa very tenacious secretions na meron or characteristic ng kanilang sakit. Now, these lower respiratory tract agents help again doon sa mga symptoms nung mga sakit na yon. The sympathomimetics, the anticholinergics, the methylxanthines, the leukotriene receptor antagonists, glucocorticoids also, mucolytics, and antimicrobials. So, ang mga sympathomimetics, we have already discussed this sa nervous system drugs. They increase CAMP, which is the cyclic adenine monophosphate. And this causes dilation of the bronchioles. Very effective for managing bronchospasm. Example is in asthma. Kasi nga sa asthma, merong pagsikip ng airway. So, bronchodilation is important para hindi magkaroon ng bronchospasm or asthma attacks. Albuterol, metaproterenol, and isoproterenol are examples of these drugs. So, remember, si beta-1 receptors found basically sa heart, and then yung beta-2, specific naman siya sa lungs. Remember to be alert with having palpitations, no? Sa pagbibigay ng salbutamol, for example, or Ventolin. And pero sa lahat ng yan, if there is acute asthmatic exacerbation, it's still epinephrine which is most effective. but bronchodilators can be given in conjunction with it. Side effects may diminish after a week, but the bronchodilating effects may decrease with continuous use because tolerance may develop. If you can see, itong mga side effects na ito is similar to the activation of the sympathetic nervous system kasi nga sympathomimetic yung mga gamot na ito, which are tremors, headaches, nervousness, increased pulse rate, again, palpitations, and increased blood sugar. That's why you have to cautiously give it to people with diabetes and also heart problems. Next are anticholinergic drugs. They are similar to sympathomimetics in such a way na nagkukos siya ng bronchodilation, but its effect is because anticholinergic siya. No, binablock niya yung effects ng parasympathetic nervous system. Ipratropium bromide or Atrovent is also effective sa asthma because it dilates bronchioles. Very few ang systemic effects niya, and it is given by aerosol or, again, nebulizations. Now, can you combine anticholinergics with sympathomimetics? Yes. But beta agonist inhalants should be administered 5 minutes before ipratropium. So, unahin ang sympathomimetic, huwag pagsasabayin because they have a totally different mechanism pero the same yung magiging effect niya. Ipratropium should be administered 5 minutes before inhaled glucocorticoid or cromolyn sodium and intal. So, ang glucocorticoid or cromolyn sodium and intal naman are anti-inflammatory drugs which can prevent the inflammation of the airway. Methylxanthines. They stimulate CNS and respiration, they dilate coronary and pulmonary vessels, and they cause diuresis. Ang methylxanthines ay respiratory stimulant, no? Which means it improves also the breathing, nare-relieve ang bronchospasm. Aminophylline and theophylline are examples of methylxanthines. And because they are respiratory stimulants via the nervous system, so nervous system stimulant siya. It's important to avoid taking coffee or chocolate, which are itself nervous system stimulants already. So si aminophylline and theophylline can be given IV, si aminophylline. Theophylline is given orally. Ang theophylline has a low therapeutic index. Normally, minamaintain dapat ang theophylline 10 to 20 micrograms per ml lang in the blood plasma. Watch out for nausea, gastric pain, tachycardia, palpitations, hypotension, dizziness, and nervousness. You have to report these side effects right away. The leukotriene receptor antagonists, on the other hand, it's a chemical mediator. It can cause inflammatory changes in the lungs, which causes bronchoconstriction. So if drugs antagonizes these chemical mediators, effective ito para ma-reduce yung inflammatory symptoms ng asthma. Again, na maaaring na-trigger ng allergens or environmental stimuli or yung mga changes in the seasons. Now, these are not recommended for acute asthma, but it can be given for prophylaxis or maintenance of chronic asthma. So, maaari itong maging mga maintenance drugs. Zafir-Lucas, Zileuton, and Montelukast are examples of leukotriene receptor antagonist. Okay? Now, it's important because maaari siyang gamiting maintenance drug. Importante na i-check ang liver function tests. And also, it is best given with an empty stomach. Next are glucocorticoids, a member of the corticosteroid family. Important ito to treat respiratory disorders, particularly asthma. Why? Because glucocorticoids have an anti-inflammatory action and it may be indicated if the patient is unresponsive to bronchodilation. Synergistic yung effect niya when given with a beta-agonist drug, so pwede siyang i-combine together. What are those? Inhaled is again beclomethasone. May mga tablets, triamcinolone, dexamethasone, prednisolone, and methylprednisolone. And yung mga IV naman, preparations of dexamethasone and hydrocortisone. So all uh, prevents or manages the inflammation of the airway, because again, as what I've said earlier, with asthma or with bronchitis, isa yung inflammation ng lower airways sa dahilan kung bakit nagkakaroon ng pagsikip ng daluyan ng air. Cromolyn sodium is an additional drug which is an anti-inflammatory drug also, but it is effective as a prophylaxis for asthma as well. Again, that's cromolyn sodium. As a prophylaxis for asthma, it may take about 4 weeks for it to be effective. Next drugs are mucolytics. They act like detergents to liquefy and loosen thick mucus secretion so that they can be expectorated. Sa upper airway infections, may mga expectorants. No? Itong lower airway infections, importante yung mucolytics. Acetylcysteine is administered through nebulization. It should not be mixed with other drugs. So, it's mucomists, kaya niyang iliquify yung mga malalapot na secretions sa lower airway para madali siyang ma-expel. So, para ma-expel siya, again, the coughing reflex is important. Importante din na ma-mobilize ang secretions. So, as nurses, we can provide chest physiotherapy to help mobilize secretions, and patient will be able to cough it easily. And aside from that, importante pa din yung pag-increase ng hydration or increase the oral fluid intake. Ang acetylcysteine ay may rotten egg odor. It's normal just because of the release of the hydrogen sulfide. Also, ang acetylcysteine, it's an antidote for an acetaminophen overdose within 12 to 24 hours given orally. Ang kanyang adverse effects, nausea, vomiting, stomatitis, and runny nose. Another important mucolytic is Dornase alpha, or the pulmozyme. It's an enzyme which digests DNA in the very thick sputum secretions for cystic fibrosis. Again, I mentioned the cystic fibrosis involves children diagnosed with very thick tenacious secretions. Kahit wala namang impeksyon, sadyang malapot yung respiratory mucus ng mga batang pinanganak na may cystic fibrosis. At dahil dyan, very prone sila sa infection or pneumonia. That's why may very poor prognosis ang may cystic fibrosis. And usually they die because of repeated pneumonia. Improvement would usually occur in 3 to 7 days. So, adverse effects, watch out for chest pain, sore throat, laryngitis, and hoarseness of the voice. Antimicrobials can also be used. This antimicrobial can be used if bacterial infection results from retained mucus secretions, and that is trimethoprim sulfamethoxazole. Maaari siyang gamitin mild to moderate acute exacerbation of chronic bronchitis from infectious causes. So again, if we recall in the anti-infectives, ang trimethoprim sulfamethoxazole is a sulfonamide. It's bacteriostatic. It inhibits synthesis of folic acid or vitamin B9, kaya hindi ito maaaring ibigay sa mga buntis. No? It's good or effective against E. coli, chlamydia. At ang sulfonamide, no, it can cause crystalluria. Kaya importante na tinuturuan yung patients to increase the oral fluid intake. So those are the respiratory drugs which basically affect the infections of the respiratory system, and they manage or treat the symptoms associated with it, such as ano-ano yung mga yon. Una, yung sumisikip na airway, kaya mga bronchodilators. Pangalawa, ito yung mga namamagang airway, kaya kailangan natin ng anti-inflammatory drugs. And pangatlo, yung mga secretions na kailangang mailabas, kailangang ma-expectorate, ma-cough out, kailangang matunaw para ma-expel yung maraming secretions whenever the airway is infected. Okay?